Good morning everyone. Again, welcome back to our online class. So for today's subject, you're going to do the health subject. So we're going to learn about the first aid. Again, so this will be your continuation of your past lesson. So let's start. So first aid for sport injuries. So this is what you're going to do for if you're having sport injuries. The first one, you're going to wash the wound with clean water. Remember, you're going to wash it with the clean water. And then, gently wipe to dry it with cloth or cotton wool. After washing your wound with clean water, you're going to pat dry it with cloth or cotton wool. And next, number 2, you're going to press the wound if it does not stop bleeding. Again, if it doesn't stop bleeding, you're going to press it with cotton wool, with clean cotton wool. Okay, so you need to press it to stop the bleeding. And then number 3, soak alcohol on cotton wool and apply around the area. It should be around the area only. Then apply disinfectant such as betadine and iodine tincture on the wound. So after putting alcohol around the wound, you're going to apply disinfectant or betadine in the wound. And then after that, you're going to cover the wound with gauze. Again, you're going to cover it with gauze if it is necessary. If it is not, if the wound is very small, you don't need to cover it, okay? And then number 5, take the patient to the hospital in case of unstoppable bleeding. If the bleed doesn't stop, you go to the nearest hospital. If you also have infected wound or deep wound, okay? So after this, you're going to learn about the first aid for bruises. So when you say bruises, it's like the blood circulation doesn't flow, okay, properly. The blood circulation doesn't flow properly. So number 1, do not apply a heat pack. The first thing that you're going to do is you're not going to apply heat pack on the bruise because it will increase the blood circulation, leading to more bruising and swelling. So it will become worse if you apply first an heat pack, okay? Number 2, use a cold cloth or cloth wrapped with ice. So you're going to do, instead of applying heat pack, you're going to apply it with ice on the wound in order to stop the blood accumulation and decrease the bruise. So use ice compress, okay? And then number 3, after applying a cold compress after 24 hours, you're going to use a cloth soaked with warm water, okay? So after cold compression, you're going to do the warm water compression, okay? So to decrease the blood accumulation. Next is first aid for fractures. If you have fractures or broken bones, this is what you're going to do. Number 1, do not let the tip of the broken area or the broken bones be moved. So do not move if you have fractures, okay? So next, do not try to mend or do not try to treat the broken bruise or the broken bones, okay? So number 2, find a long hard stick such as wood or hard ruler, okay, to be cast and then wrap with cloth or rope firmly in order to prevent the broken area from moving. So a temporary cast helps prevent the broken area from moving. And then number 3, take the patient to the hospital immediately. Next, we have cramps. So when you say cramps, it is the most common symptom caused by the contraction of muscle. So your muscle is contracting. So the first aid that you're going to do is stretch the cramp muscle in the same direction of your muscle movement. So push the toe to relax the calf muscle. So you're going to press or you're going to stretch the cramp muscle in the same direction, okay? And then number 2, apply a warm pack of cloth or cloth soaked with warm water on the cramp muscle and massage gently to increase blood flow. And then number 3, cramps happens or it is the cause of cramps if you have dehydration. You should drink more or lots of water. Nutrition deficiency and mineral deficiency can cause cramp to happen in many spots. Thus, keep the patient's body warm. You're going to keep your body warm and feed him the mineral drinks continuously in order to relax the contraction. Okay? And then we have first aid for sprained or twisted ankle. So what we're going to do is you're going to apply a cloth soaked with cold water to the injured area and then wrap with an elastic bandage. So you're going to wrap it with an elastic bandage. And then number 3, compress with cloth soaked with warm water after 24 hours of cold compress. Okay? So you're going to do, if you have sprained or twisted ankle, you're going to do the cold compress and then you're going to wrap it with elastic bandage. Second, you're going to do is to soak it in warm water after 24 hours of cold compression. Okay? And then this one, first aid for fainting. Okay, so when you say fainting, happens from many causes such as if you have weak body, deficiency of the air because you are in a crowded area, and it is also happens from staying in an area with high temperature. Okay? Or if you are playing sports. It happens if you have weak body and if you can't breathe properly. So number 1, this is what you're going to do. The first aid that you're going to do. Immediately take the patient to a shady and airy area. If it happens outside, you go under the tree or with some shade, and you do the first aid in an open space. Okay, lay the patient down on the floor in a relaxed position. So you're going to lay it down with a relaxed position so the patient could breathe and oxygen, okay? And then loosen the clothes of the patient. If the patient is wearing very tight clothes, loosen the clothes of the patient. And then number 3, give the patient ammonia to smell. Okay, so you're going to give the patient something to smell like ammonia. Okay, so that is some first aid that you're going to apply if some accident happens. So for your activity, you can open your book on pages 78 to 79. So for 78, this is what you're going to do. So you're going to select 2 of the given injuries. So the given injuries we have is hornet sting, bruise, cramp, fainting, and twisted ankle. So the first injury, you're going to choose one injury only. And then you're going to write down the cause and the ways to perform the first aid. So you're going to write down, for example, bruise. What are the ways to perform the first aid? So what are you going to do if you get bruise? And then that's also what you're going to do in the second injury. Okay? Did you understand? Okay, so that's all for today. Thank you everyone for listening again. This is Teacher JJ, your health teacher. So goodbye. Have a great day, everyone. See you again next week.